All right, welcome everybody. We're here on chapter 10 of the Public Health Emergencies case studies book, and we're talking about extreme heat and the impact on public health this time. So climate change, as you know, is a complex global phenomenon that affects pretty much every sector of society. But from a public health perspective, one of the most immediate concerns is extreme heat. Over the past 2 decades, we've seen a clear increase in the frequency, intensity of heat waves and heat events. NASA reports that 17 out of the 18 hottest years on record in the US have occurred since 2001. And in 2017, multiple state records were broken. I know this book was written a few years ago, but I imagine these statistics, at least from what I've seen, have only gotten hotter and added to those record years. When we think about causes, greenhouse gases come from both natural and human sources. Natural contributors include volcanoes, wetlands, thawing permafrost, and human or anthropogenic sources play the dominant role in current global warming. These include fossil fuel combustion for transportation and electricity, industrial processes, agriculture, land use changes, and waste management. Climate models combine historical data with projected emissions to estimate future warming. The key takeaway here is this: future temperature increases depend heavily on how much we reduce emissions now. Lower emission scenarios project substantially less warming by 2100, while high emission scenarios like RCP 8.5, this is a projection that signifies uh, extensive warming in the future. In other words, policy and mitigation decisions today directly influence long-term climate outcomes. So heat waves are becoming more frequent and more intense across the US, and that's a major public health concern. The National Climate Assessment projects 20 to 30 additional days over 90 degrees in most regions by 2050. By 2100, days with heat index values above 100 degrees could double, and extreme heat above 105 could triple. We've already seen that about a 1.2 degree Fahrenheit increase in average temperatures compared to the early 20th century. Future warming depends heavily on emissions, but under high emission scenarios like RCP 8.5, some regions could see temperature increases approaching 9 to 10 degrees by late century. The bottom line is that extreme heat is becoming more common and more dangerous. Now, extreme heat isn't just about hitting a specific temperature like 90 degrees. The CDC defines it as temperatures that are substantially hotter or more humid than what's normal for a particular place and time of the year. How we experience heat depends on more than just temperature. It includes humidity, solar radiation, and even cloud cover. Because every region has different climate patterns, extreme heat thresholds vary by location and can even shift throughout the summer. Heat events are typically identified by comparing current conditions to historical averages, and in some cases by using site-specific mortality algorithms that estimate health risk based on forecasted weather. Extreme heat affects health in both direct and indirect ways, and the impact depends on environmental conditions and community vulnerability. As heat events become more frequent, intense, and longer lasting, they're becoming one of the most urgent public health threats. They already cause more deaths than any other type of natural disaster. Directly, we see heat stroke, exhaustion, cramps, and spikes in hospitalizations for cardiovascular, kidney, respiratory, and mental health conditions. Chronic dehydration and occupational heat exposure can even lead to long-term kidney disease. Projections suggest major U.S. cities could see thousands of deaths during extreme events, depending on warming scenarios. Indirectly, heat worsens air pollution, strains health systems, disrupts infrastructure, and even influences behavior and community stability. When we talk about extreme heat in cities, one key concept is the urban heat island effect. This happens when natural land, like soil and vegetation, is replaced with concrete, asphalt, and buildings that absorb and trap heat. As a result, cities become significantly hotter than surrounding suburban and rural areas. This matters because the world is rapidly urbanizing. Since 2007, more people have lived in cities than rural areas, and over half the global population is now urban. By 2050, that number is expected to reach about two-thirds, especially in Asia and Africa. So as cities grow, the urban heat island effect can amplify heat waves and increase health risks for urban residents. When we think about extreme heat, vulnerability isn't evenly distributed. People who live in cities, work outdoors, are very young or elderly, or have chronic diseases are at much higher risk of illness and death during heat events. Social vulnerability plays a huge role. Low-income individuals, socially isolated populations, and those without access to healthcare or air conditioning often have fewer options to adapt. In many cities, these neighborhoods also lack green space and can be dramatically hotter, especially at night. We also see a higher mortality in rural areas and among outdoor workers, like those who work in agricultural industries. If we add in risk factors like social isolation, limited mobility, and chronic conditions such as diabetes or heart disease, the danger from extreme heat increases significantly. And this diagram here is helping us visualize all these different risk factors that combine to affect how extreme heat events can affect our health. Looking at things like individual age, occupation, how those things can combine with people's behavioral choices, like what clothing, eating habits, what they're doing, proper hydration, those type of things as they're being exposed to the different levels of heat, and how the different microclimates within, we talked about urban heat islands and how there can be different variations of temperature depending on your environmental attributes, like how much shade is being provided versus the density of non-permeable surfaces like asphalt and concrete, which don't really provide much relief uh, from the effects of heat. um, so all those different factors combined can affect and make extreme heat events um, more more concentrated and more difficult to uh, have a different impact on people's health outcomes. So depending on those risk factors. So we talked a little bit about this in that visual on the last slide, but environmental risk factors are the conditions around us that increase the likelihood of heat-related illness. Things like air temperature, humidity, wind speed, solar radiation, and even the built environment all influence how our bodies experience heat. The heat index is one common way that we estimate uh, perceived temperature. The heat index combines air temperature and humidity, but it doesn't fully account for a hot, dry wind, which can increase dehydration risk. Regional context also matters. Cooler regions may not require air conditioning, so prolonged heat waves can hit harder. Urban design, microclimates, and access to cooling centers all as well as healthcare, all shape how vulnerable a community is and how effectively public health systems can respond. When we talk about heat risk, it's not just the environment, it's also who people are and how they live. Sociodemographic factors matter a lot. Children, older adults, socially isolated individuals, low income populations, and people with limited access to education or healthcare are all more vulnerable during extreme heat events. Pre-existing conditions like diabetes, heart disease, and obesity also reduce someone's ability to adapt to heat. And behaviors play a role. Things like wearing dark clothing, not drinking enough water, drinking alcohol, spending long hours in the sun, or even eating heavy, high protein meals can all increase core body temperature and raise heat related health risks. As extreme heat events become more frequent, public health just can't react. We have to predict, prevent, and reduce the health burden. The American Public Health Association and partners developed a framework built around the 10 essential public health services to guide that work. When it comes to extreme heat, responses have to be practical and locally tailored because severity and risk vary by region and by population. Vulnerability isn't evenly distributed, so planning has to be multidisciplinary, bringing together meteorologists, healthcare professionals, emergency managers, and social services, grounded in an understanding of regional variation and health inequities. When we talk about competencies in responding to extreme heat, it really comes down to data, tracking illnesses and death over time, identifying vulnerable populations, forecasting heat events, and knowing where resources like cooling centers are located. That means pulling from multiple data streams, environmental data like temperature, land surface temperature from satellites, vegetation and urban design, social data that reflects inequities, and clinical data like syndromic surveillance, lab results, pharmacy usage, and emergency calls. When you integrate all of that data, you can build early warning systems, conduct heat vulnerability assessments, and guide smarter interventions like neighborhood greening or targeted outreach in high risk communities. When we're talking about competencies here, it's really about identifying and understanding heat-related health risks at the community level and having the data systems to support that. That includes healthcare access, insurance coverage, diagnostic capacity, and especially since extreme heat can trigger multiple issues, even emerging vector-borne diseases like malaria or dengue or West Nile virus. A major limitation, though, is the lack of high resolution geolocated health data. To address this, tools like the Cumulative Heat Vulnerability Index used in places like Maricopa County in Arizona. Several major cities also use it. They help map who is most at risk. Methods range from participatory assessments and map overlays to cluster analysis and using machine learning models that combine environmental and health data to forecast vulnerability and guide targeted interventions. Now, as we're talking about this particular essential public health service, which would be disseminating public health information, we're really talking about strengthening communication, making sure researchers, public health professionals, and policymakers are aligned in addressing health risks from extreme heat events. There are still major knowledge gaps around environmental heat and climate change, and that lack of awareness can limit people's abilities to adapt. So outreach has to be targeted. We have to take into account cultural differences, levels of vulnerability, and access to resources. Sharing heat vulnerability assessments with community organizations, schools, healthcare providers, and emergency management agencies helps helps build awareness and support prevention efforts. Agencies like the Environmental Protection Agency, the EPA, also play a role by providing public guidance, while researchers use high resolution spatial data to identify and predict high risk areas. This allows interventions to be more focused and proactive. Addressing extreme heat really requires building strong partnerships. That means bringing together academia, private organizations, federal, state, and local governments to create coordinated, multi sector responses. Most of this work starts locally, identifying vulnerable populations, proposing policies, and implementing adaptive measures. It also means collaborating beyond traditional public health, working with city planners, architects, and transportation leaders to promote climate resilient design and expand green infrastructure, increasing tree canopy, parks, cooling spaces. These directly help reduce urban heat island effects. And finally, public awareness is key. Educating residents about heat illness, training clinicians, and connecting communities to resources help support cooling and energy cost reductions during extreme heat. Public health professionals, clinicians, and scientists need to work together to translate mortality and morbidity data into clear, actionable messaging and policy. That includes targeting high risk neighborhoods, strengthening surveillance, engaging providers, educating residents, and designating cooling center locations. Mitigation strategies can range from cool and green roof programs to multilingual hotlines, public messaging campaigns, websites, and coordinated early warning systems with local meteorologists. Maricopa County in Arizona is a great example. They brought together 45 organizations to align climate and health efforts and developed a strategic plan focused on awareness, environmental action, collaboration, celebrating progress, as well as targeted communication. Protecting city dwellers during extreme heat events starts with public health professionals translating science into policy. Once laws are in place, Agencies must actively enforce protections, especially for outdoor workers. That means working with employers and OSHA to ensure access to shade, water, longer breaks, and adjusted schedules during peak heat. At the same time, police and first responders need training to recognize heat-related illness and to check on vulnerable and homebound residents. And importantly, utilities must enforce no disconnection rules so residents are not left without electricity and without air conditioning during dangerous heat events. A strong health response program for extreme heat has to function like disaster infrastructure. It needs integrated systems that can continue delivering care even when normal services are disrupted. Under the National Response Plan, specifically Emergency Support Function 8, which covers public health and medical services, heat response planning happens at the local, regional, and national levels. That includes expanding surge capacity, coordinating emergency medical systems, and preparing specialized services. It also means anticipating interruptions to routine care, monitoring vulnerable households, and connecting people to social and financial support programs that can literally prevent heat-related deaths. At the core of any strong health system is a well-prepared workforce. As extreme heat becomes more frequent and complex, we need professionals who are not only competent today, but equipped to handle emerging challenges in the years ahead. That means updating the health system with multidisciplinary expertise. We need to bring in specialists who understand urban health, climate science, vulnerability modeling, and even economic impacts. Systematic training programs should align with essential public health services at the state and local levels while also expanding professional skill sets beyond traditional public health boundaries. Beyond just planning and implementing heat mitigation strategies, public health professionals are also responsible for evaluating whether those interventions are actually effective, accessible, and equitable. Ongoing evaluation strengthens response plans and improves communication across stakeholders. For example, Phoenix's network of cooling centers in Maricopa County provides not just air-conditioned space, but food, water, shelter, and counseling, showing how adaptation efforts can be layered and comprehensive. Importantly, using community surveys and data like Maricopa County did helps ensure programs are evidence-based, equity-focused, and this is essential for advancing climate justice. And the final step is really about advancing innovation. We want to encourage researchers and public health professionals to develop and refine adaptive strategies for extreme heat. That includes conducting research on emerging health impacts, strengthening best practices, and connecting academics with practitioners to analyze policy, epidemiology, and health system responses. Practically, this means sharing data and research protocols, coordinating funding efforts across public and private sectors, and building collaboration among universities to strengthen heat adaptation strategies. Severe heat waves are becoming a major public health concern, and they're expected to intensify as greenhouse gas emissions continue to rise. We've already seen record breaking events in this century, and extreme heat is now one of the leading causes of weather-related deaths. Our bodies struggle with temperatures we're not acclimated to, and social and biological vulnerabilities make adaptation even harder. Because extreme heat events can impact large vulnerable populations very quickly, we need rapid response systems and stronger public awareness. That's where the 10 essential public health services come in. They provide a coordinated framework to prepare communities, reduce inequities, and protect lives at the local, state, and national levels.